Hi guys, my name is Michelle. I'm a tutor for Chegg Tutors and I usually tutor in English, math, and psychology. So today we're going to be talking about obsessive-compulsive disorder, or often abbreviated OCD. So OCD is a common chronic and long-lasting disorder in which a person has uncontrollable reoccurring thoughts and behaviors that he or she feels the urge to repeat over and over, and these thoughts can interfere with people's lifestyles, relationships, and more. So here, let me give you some symptoms of obsessions and compulsions, or both, and let me define them. So obsessions are often defined as repeated thoughts, urges, or mental images that cause anxiety. So some symptoms might include a fear of germs or contamination, unwanted, forbidden thoughts, involving sex or religion and harm, aggressive thoughts towards others or self, and they might have symmetrical or urges to have things in symmetrical or in perfect order. Compulsions, on the other hand, are repetitive behaviors that a person with OCD feels the urge to do in response to the obsessions. So this might include excessive cleaning or hand washing, ordering and arranging things in a particular precise way. They might need to repeatedly check on things like if they lock the door or if the oven is off, and they might need to do compulsive counting before they can proceed in their task. So some individuals with OCD also tend to have a tic disorder. Motor tics are sudden repetitive movements such as eye blinking, facial grimacing, shoulder shrugging, and so on. Vocal tics might present themselves as repetitive throat clearing, sniffing, or grunting sounds, or more. So the cause to this disorder is currently unknown, but there appears to be some genetic components. So in twin studies, both identical twins are more often or more likely to be affected than non-identical twins. And also, this disorder might have an increased risk factor if there is a history of child abuse or other very high stress-inducing events. This might create a higher vulnerability to OCD. The way that we treat OCD, it involves behavioral therapy and sometimes aided with SSRIs, serotonin reuptake inhibitors. So behavior therapy works to increase exposure to what causes the problems while not allowing the repetitive behavior to occur. So it allows people to go through their day without needing to, for example, check if their door was locked. And it keeps them calm throughout this anxiety that they need to check on the door, for example. So according to the DSM, to be diagnosed, officially diagnosed with OCD, a person must have obsessions, compulsions, or both. And not only do they have to have these obsessions or compulsions, these they have to be time consuming and interfere with normal ways of living. Yeah, so that's a little bit about OCD. I hope you enjoyed your lesson. Thank you for listening. Have a good day.